The UK has the second highest respiratory death rate in Europe. ITM Business recently sat down with Sarah Woolnough, CEO of Asthma Lung UK, to discuss why this is, what's being done about it, and what more we should be doing.
It seems like it takes a long time for a lung condition to be formally diagnosed. Why is this, and how can we fix it?
Well, we know too many people are waiting too long for a diagnosis. That's for a range of reasons. Partly, people often take a while to go to the doctor or to seek help. They often don't recognise that breathlessness is a symptom they can seek help for. We then know there's a really big issue at the moment of GPs and others in primary care not having quick access always to the key tests that diagnose lung conditions. And there's a related funding issue and a training issue. So through COVID, many people's training lapsed, and it's taking a significant amount of time to build back up the capacity, the funding for the right tests.
People living in the poorest communities are 7 times more likely to die from a lung condition. How can we address this glaring inequality?
Yes, there are very stark inequalities in lung health, and we need to really understand the causes of lung ill health. So tobacco, toxic air, poverty, lack of nutritious food, damp and mouldy housing. And so we want to see the fundamental causes of lung conditions tackled, more money for smoking cessation programs, ambitious policies to tackle toxic air, as well as more support to people living in poverty and particularly struggling with the cost of living crisis. That's what we need to do in order to really stop people developing lung conditions in the first place. But then when they do, and if they do, we need to make sure that we're diagnosing and treating them effectively and that everyone can access the best possible care.
You mentioned air pollution there, which we all know is damaging to our health. Now, Asthma Lung UK are involved in the Healthy Air Coalition. Will you tell us a bit more about that?
So the Healthy Air Coalition is a group of 27 health, environmental and transport organisations that have come together to campaign for clean air. We know that we're stronger together, and we want to both raise awareness of the impact of toxic air on people's health, but also then to push for a whole range of different policy measures to ensure that everyone can breathe clean air wherever they live, whatever their background.
In September 2023, Asthma Lung UK and the Task Force for Lung Health published a report called Saving Your Breath, which was really a call to action. Would you be able to share some of the key messages from that report?
Well, this report is really about making sure that people are aware just what an impact lung conditions have on people's health. Lung conditions are the third biggest killer across the UK, affecting 1 in 5 of us across the course of our life and costing the NHS a huge amount. So this report updates the figure. £9.6 billion is the cost of ill health to our health service. So we're calling on governments, the health service and others to help prevent lung conditions, but also ensure that where people are breathless or they have other symptoms, they're getting diagnosed as swiftly as possible, and then they're getting treated effectively. And that's some really basic things. So we want people to get access to good treatments, but also regular inhaler checks, an action plan so they know how to look after themselves and stay well and out of hospital. And also they get access to exercise programs like pulmonary rehabilitation, which helps breathing if they are eligible. So a range of measures we'd like to see, but saving your breath is really about saying, let's prioritise lung conditions. Historically, there's been a lack of focus, a lack of priority, and we want to see that reversed.
It seems like you're saying the cost of underfunding lung disease is actually enormous.
A huge lack of funding, both to understand how lung diseases develop, so we'd like to see more money invested in research and innovation, but then also sufficient resource to effectively diagnose and treat lung conditions.
Sarah Woolnough from Asthma Lung UK, thank you very much.